6 isometric exercises for strong legs even after 40. With fitness culture increasingly on the rise, it's normal to think that to get good results, we need to strictly follow what professionals do. Complete 2-hour workouts, meticulously calculated diets, advanced supplementation, and in some extreme cases, even the use of prohibited substances. It seems like we need to dedicate our entire life to our body to achieve any result. However, the truth is that it's entirely possible to transform your body without having to live exclusively for it. That's why today, you'll see 6 isometric exercises, where we stay still, maintaining a position that will keep your legs strong regardless of your current age, and the best part, without all the bureaucracy that modern fitness culture imposes. But before we begin, please leave in the comments your name and the city where you're viewing our content. Isometric exercise number 6, horse stance. The horse stance is one of the most underestimated exercises when talking about leg strengthening. This movement intensely works your quadriceps, which are the front muscles of the thighs, while also engaging adductors, glutes, and core in an impressive way. The most interesting thing is that, despite seeming simple, this exercise has ancient roots in Oriental martial arts, where it was used not only to strengthen the body, but also to develop mental endurance. To execute correctly, start by positioning your feet a little wider than shoulder width apart, with your toes pointing outward at approximately 45 degrees. Bend your knees and lower yourself as if sitting in an invisible chair, keeping your back straight and chest forward. The final position should resemble the posture of a mounted knight or a sumo wrestler. The secret is in the height. Only descend to where you can keep your knees aligned with your toes, without them going beyond that line. Keep your arms extended in front of your body, or in a guard position for greater stability. A valuable tip is to breathe deeply during the posture. Inhale through your nose, counting to 4, hold for 2, and exhale slowly through your mouth, counting to 6. This technique not only helps with muscle oxygenation, but also transforms the exercise into an almost meditative practice, reducing stress, something particularly beneficial for those over 40 who need to better manage cortisol levels for more efficient results. One of the most common mistakes in this exercise is excessively curving the lower back, creating an exaggerated curve in the back. This transfers tension to the lumbar region and decreases leg work. Another frequent error is letting the knees collapse inward, which can lead to injuries in the long term. Always keep your knees aligned with your toes and consciously activate your glutes to maintain this position. For beginners, I recommend starting with 3 sets of 20 to 30 seconds, with a 90-second rest between them. As your endurance increases, you can progress to 3 sets of 45 to 60 seconds. The beauty of this exercise is that you can do it anywhere. This flexibility makes it much easier to incorporate into your routine. Exercise 5, static lunge. The static lunge is a magnificent exercise for those looking to strengthen their legs without overloading the joints. This movement intensely works the quadriceps, hamstrings, glutes, and adductors, while also challenging your balance and stability in a safe and controlled manner. What makes the static lunge especially valuable is its ability to strengthen each leg individually, correcting muscle imbalances that we naturally develop over the years. To execute the static lunge correctly, start standing with your feet aligned with hip width. Step forward with one of your legs, keeping your torso upright. Bend both knees until forming 2 90-degree angles, with the front knee aligned over the ankle and the back knee almost touching the floor. The weight should be distributed between the heel of the front leg and the ball of the back foot. Your hips should be level and facing forward, as if they were between 2 parallel walls. In this position, you simply hold. It seems easy in the first few seconds, but soon you'll feel the challenge. The magic of isometrics lies precisely in this prolonged hold, which deeply recruits muscle fibers and promotes endurance and strength without significant joint impact. A common mistake I see in my students is allowing the front knee to go beyond the ankle line, which puts excessive pressure on the joint. Another frequent error is leaning the torso forward, which reduces glute work and overloads the lower back. Keep the torso vertical, as if being pulled upward by an invisible thread at the top of your head. For beginners, I recommend 2 sets of 30 seconds for each leg, with a 60-second rest between sets. As you progress, you can increase to 3 sets of 45 to 60 seconds per leg. Remember that quality surpasses quantity. It's better to maintain a perfect posture for less time than to compromise form and risk injuries. An interesting variation I implement with my more experienced students is what I call the pulsing lunge, where you maintain the isometric position, but every 10 seconds you lower just 1 centimeter and return to the original position. This micro variation significantly increases intensity without adding impact, perfect for those over 40 seeking progressive challenges without compromising joint health. Exercise 4. Isometric glute bridge. This exercise intensely works the gluteus maximus, medius, and minimus, as well as the hamstrings and spinal erectors, forming a powerful support system for your lower back and hip. As we age, the strength of these posterior muscles tends to decrease due to excessive time sitting, which can result in lower back pain and even more serious postural problems. Something I've discovered over the years working with older clients is that the isometric glute bridge has benefits that go far beyond aesthetics. This exercise is exceptional for improving pelvic floor function, especially important for women after menopause. Additionally, it strengthens the hip stabilizers, which can significantly reduce the risk of falls, a real concern as we age. That's why I always say this isn't just an exercise to get a nice butt, but an investment in quality of life and functional independence in the long term. To execute the isometric glute bridge correctly, lie on your back on a mat or comfortable surface, with your knees bent and feet flat on the floor, about hip-width apart. Your arms should be extended along your body, with palms facing down. Now, contract your glutes and lift your hips until forming a straight line from your chest to your knees, no higher than that. The crucial point of this exercise is, once in the elevated position, to remain completely still, creating constant tension in the target muscles. The main mistakes I observe in people over 40 when performing this exercise include excessively arching the lower back, creating an exaggerated curve that overloads the spine instead of working the glutes. Another common error is raising the hips too high, which also transfers tension to the lower back. Remember, the goal is not to go as high as possible, but to create a straight and stable line from your chest to your knees. For beginners, I recommend 3 sets of 30 seconds in the isometric position, with a 75-second rest between sets. As your strength increases, you can progress to 3 sets of 45 to 60 seconds. A valuable tip is to perform a mental test during the exercise. You should be able to place a glass of water on your belly without spilling a drop. This ensures that your core is stabilized and your pelvis properly positioned. Before we continue to exercise 3, don't forget to subscribe to the channel. Having constant access to correct and science-based information is what will make you progress with long-term health in the world of bodybuilding. Exercise 3. Isometric calf raise. The isometric calf raise is an extraordinary exercise that often goes unnoticed, but offers impressive benefits, especially for those over 40. This movement intensely works the calf muscles, gastrocnemius and soleus, which function as a second heart pump in the body, aiding in venous return and reducing the risk of varicose veins and edema, common problems with advancing age. Additionally, strong calves are essential for stability when walking and running, reducing the risk of falls and injuries. A fascinating aspect of calves that few people know is that they contain a high proportion of slow-twitch muscle fibers, which means they respond extraordinarily well to endurance and isometric training. Therefore, even if you've neglected your calves for decades, they have incredible development potential even after 40, 50, or 60 years. To execute the isometric calf raise correctly, start standing with your feet hip-width apart. Raise yourself onto the balls of your feet as high as you can, keeping your legs straight, but without locking your knees. Now comes the isometric part. Maintain yourself in this elevated position without swaying. You can use a wall or chair for support and balance, but try not to depend completely on this support. The secret is to fully elevate yourself and sustain the position, creating constant tension in the calves. A common mistake in mature individuals is not rising high enough, remaining in a partial elevation that doesn't fully recruit the muscle fibers. Another frequent misconception is transferring weight to one side of the foot, usually the outer side, which reduces the effectiveness of the exercise and can cause imbalances. Keep the weight evenly distributed across the balls of your feet, just before the toes. I recommend 3 sets of 30 seconds in the elevated position, with a 60-second rest between them. As your endurance increases, you can progress to 3 sets of 60 to 75 seconds. An interesting progression is to perform the exercise on an elevated surface, like a step or yoga block, allowing greater range of motion when you let your heels drop below the support level before raising yourself again. Here's a tip I learned from a physiotherapist specialized in rehabilitating senior athletes. Perform this exercise barefoot whenever possible. This not only strengthens the intrinsic foot muscles, another group that tends to weaken with age and nobody talks about, but also improves proprioception, the awareness of your body's position in space, which naturally decreases with passing years. This simple change transforms the exercise into a dual workout, strengthening and neurological training. Exercise 2. Wallsit. The wallsit is one of the few exercises that manages to combine intensity with low impact on the joints. This movement deeply works the quadriceps, adductors, and partially the glutes and core, while practically eliminating the pressure on the knees that can occur in dynamic squats. What makes this exercise particularly valuable for mature people is its ability to develop muscular endurance and strength without requiring extreme joint mobility. A fascinating aspect of the wallsit is what happens internally during the hold. By maintaining the isometric contraction, you cause a partial occlusion of blood vessels in the legs, limiting both blood flow and the removal of metabolites. When you finally relax, there's a flood of blood rich in nutrients and growth hormones to the region, a phenomenon similar to blood flow restriction training, but without special equipment. To execute it correctly, position yourself with your back completely supported against a smooth wall. Place your feet about 12 to 24 inches from the wall, keeping them parallel and shoulder-width apart. Slowly slide down the wall until your knees form an angle of approximately 90 degrees, as if sitting in an invisible chair. Your thighs should be parallel to the floor and your knees aligned over your ankles, never going beyond the line of your toes. Now, simply maintain this position. The most common mistakes I observe in practitioners over 40 include not descending enough, remaining in a position that's too high and doesn't generate adequate tension in the quadriceps. Another frequent misconception is arching the lower back, moving it away from the wall, which not only reduces the effectiveness of the exercise, but can also overload the lumbar region. Keep your spine neutral, with your lower back gently pressed against the wall. For beginners in this age group, I recommend starting with 2 sets of 20 to 30 seconds, with a 60 to 90 second rest between them. As your endurance increases, progress to 3 sets of 60 seconds. Remember that quality time is more important than quantity. It's better to maintain a perfect position for less time than to compromise form to endure a few more seconds. A variation I developed for my more experienced students is what I call the wall sit with pressure. Position a tennis ball or a small firm cushion between your knees and apply moderate pressure throughout the exercise. This adds an adduction component that intensifies the work of the inner thigh muscles, often neglected in other exercises. This small modification not only increases intensity, but also improves knee alignment, reducing the risk of injuries and maximizing benefits for the hip and knees, 2 joints that tend to give us problems after 40. Exercise 1. Isometric plank with leg raise. We've reached the last and most difficult exercise on the list. The isometric plank with leg raise is a truly complete exercise that goes far beyond strengthening the legs, offering integrated benefits for the entire body. This movement intensely works the core, glutes, quadriceps, hamstrings, and adductors, while challenging your balance and stability. The beauty of this exercise lies in its ability to strengthen the deep stabilizing muscles that often weaken with age, contributing to better posture and reduced back pain. Just as when you perform the isometric calf raise barefoot, this exercise also offers a high impact on the body's ability to perceive its position in space. By challenging your balance in a controlled manner with the leg raise during the plank, you are essentially recalibrating your proprioceptive system, improving your stability in daily activities. To execute the isometric plank with leg raise correctly, start in the traditional plank position. Support yourself on your forearms or hands, if you prefer, and on the tips of your toes, creating a straight line from heel to head. Your core should be engaged, which means you should feel as if you're pulling your navel toward your spine. Now, without rotating your hip, slowly raise one leg about 6 to 8 inches from the floor and maintain it in this elevated position. The challenge is to maintain both the plank and the raised leg without the hip rotating or dropping. The most common mistakes include letting the hip drop to the side of the raised leg, which drastically reduces the benefits of the exercise and can overload the lower back. Another frequent error is excessively arching the back or raising the hips, losing body alignment. Remember, The effectiveness of this exercise is in maintaining the straight line of the body while challenging stability with the leg raise. I recommend starting with 2 sets of 15 to 20 seconds of hold for each leg, with a 30-second rest between sets. As your strength and endurance increase, progress to 3 sets of 30 to 50 seconds per leg. If the forearm plank is uncomfortable for your shoulders, the version with support on your hands is an excellent alternative. A valuable tip I always share. Before starting this exercise, perform a few seconds of 360-degree abdominal breathing. Inhale, expanding your abdomen in all directions, front, sides, and back, and exhale, gently contracting. This preparation activates your transverse abdominis, the deepest core muscle, allowing for a more stable and efficient plank. This simple pre-exercise ritual can make all the difference, especially for those who have noticed some instability in the lumbar region with advancing age. And if you like isometric postures and want to learn 5 others that can change your entire body, and not just your legs, we've left a video appearing now on screen where we show and explain each of them better. Don't miss it. Thank you for watching this far, and may God bless you, my friend.